Okay, so today we're going to go through some nasal breathing exercises. So, some quick little things that you can do at home so that you can start breathing through your nose a little bit easier and better. So, again, why do we always want to breathe through our nose? So, we know that the nose is the organ of breathing. The nose is for moisturizing, humidifying, and warming the air. Also, it filters the air. So we have more of an immune complex associated with the nose. And what that means is there's more immune cells, there's more immune processes that occur in and around the nose, so that any sort of viral or bacterial pathogen or basically what I mean by that is a virus or bacteria that you might be picking up can better be filtered out when we actually breathe through the nose. Also, nasal breathing is going to increase nasal nitric oxide level, which is good for regulating blood flow, platelet function, improving immunity, which is very, very important right now and always. And it also enables our lungs to be able to absorb more oxygen. So when we breathe through our nose, we want to do really deep diaphragmatic breathing. So the diaphragm sits right here underneath the chest, and the diaphragm on inhalation will drop down. So as we breathe in and we're doing deep diaphragmatic breathing, what we should notice is that our belly actually rises. So when I take a breath in, I should see this lower hand here rise and fall as opposed to this upper hand. When I'm breathing in, and this is the breathing exercise I actually want you to do, I actually want you to place one hand on the chest and one hand on the belly or the abdomen. And as we breathe in and out of the nose, I want you to look in a mirror and notice which hand is moving. So the hand on the belly should be the hand that is going up and down with breathing. So you take a deep diaphragmatic breath in, which will cause the belly to expand. And then you breathe out, which will cause the belly to contract back in. So again, now, as you can probably hear, you could actually hear me inhaling and exhaling, and that's okay as you're trying to understand and watch if you're breathing through the chest or the belly as you're getting used to it. But as you continue to go through this exercise, what I really want you to focus on is really light breathing. So it's almost as if you put your finger underneath your nose here and you can barely feel the air on your finger, okay? So to start off, hand on the chest, hand on the belly, making sure that you see the rise and fall of this lower hand here and not this upper hand. And if you do see it here on the upper, just keep working until you can see the rise and fall of the belly. And don't be too hard on yourself. This is something, if you haven't been used to it, that might take a little bit of work for you. As you continue to do this breathing, again, as you can hear me breathe in and out. As you understand that you're in a rhythm of deep diaphragmatic breathing, then I want you to slow your breathing down a little bit. You could even place your finger and just make sure that as the belly is rising and falling, that you feel very light, almost no air on your finger there. Okay, so that is how we're going to get started. That's the first breathing exercise that I want everybody to get started with. Only want you to do this 3 to 5 minutes a day. Again, be gentle with yourself. Give yourself some grace. If this is something new for you, for a lot of people are chronic mouth breathers. So, give yourself a little bit of grace and allow yourself to really work towards getting better at nasal breathing. Okay, so I hope this was helpful. If you have any questions, always feel free to comment. Send us an email at info@clevelandtmjsleep.com. Visit the website, www.clevelandtmjsleep.com. And if you have questions or need to make an appointment, you can set up a virtual consultation there or just call up 440-683-4777 and you can make an appointment with us. All right, hope this was helpful. Talk to you soon.